So there is a medical condition where almost all of your outer skin just sort of sloughs off. It's called toxic epidermal necrolysis. And yes, I did have to practice that. It's basically a really severe drug reaction. You take some kind of medication. There's no sort of particular rhyme or reason to this. Your skin becomes really red and blistered and painful, and if you just use the slightest pressure, the outer layer of it comes away. It's one of the only life-threatening things that can happen with regard to your skin, because it is quite often fatal. Um, However, as of 2025, there may actually be a treatment, and this is due to a new method for sort of figuring out what are the mechanisms behind a disease. It's called spatial multiomics, where you basically take a sample of someone's tissue, in this case their skin, and you can literally map out all the individual cells and look at like which genes are active, which proteins are there, and kind of figure out what exactly is going wrong and how it's sort of ramifying through all these different cells and sort of and causing this large scale effect. And as a result, the researchers who did this were able to identify a particular signaling pathway that's operating in the skin, part of the immune system, picked out a drug and treated it. And the results, it's only a small study, only a handful of people, but the results were kind of pretty incredible. As there was one patient who had lost about a third of his outer skin, and he grew pretty much all of it back within 16 days. Now, this needs to be replicated, but it may be that this particularly scary skin condition might actually have a treatment.